I am Himanshu P. Desai. I'm a gastroenterologist and nutritionist at the Trinity Health System. I've always lived in Steubenville, and Trinity has been the closest hospital to me, so we've developed a long-term relationship. I've been in the area for almost 25 years now. I'm a big soccer fan, and I used to coach a lot of soccer and learned a lot about teamwork through soccer. And so what we've devised is each of our team members, the MAs, the patient care representatives, the nurse practitioners, the doctor, they all have a role. And that role's perfectly defined in writing, and all our members are trained to accomplish that role. We really have a world-class GI unit here. We perform mainly endoscopic procedures, but we've branched out into other procedures such as motility procedures, including manometry. Our practice values patients' time, so we like to give them timely care. We'll use evidence-based medicine, so we try and give the best quality we can based on that medicine. So that incorporated technology, which we acquired, PillCam, which is the latest technology where you can swallow a pill and it takes pictures as it travels inside of you. We're into nutrition, so we measure your metabolic rate with a VO2 test. We're into irritable bowel syndrome, so we can measure your gas levels in your body with a hydrogen breath test. And we have a smart pill, which is the latest acquisition, and that travels through your body taking pressure measurements, and it reads if they're diseased or not. What we've started to create new are patient care pathways. So we're concentrating on disease states. And the current disease states we're focusing on are the motility aspects of it, particularly fecal incontinence. That's a largely unreported disease in our valley, and obviously very functionally disabling. And so we want to try and target patients to have this come forward and get checked. We have a disease care pathway for heartburn. And it's not like you would just have one test for heartburn. You can have all these different tests based on what you complain of and what's needed for you. Another disease pathway we have is our metabolic program, where we're targeting fatty liver and weight loss based on fatty liver. Fatty liver is becoming the #1 cause of liver disease in this country, and it's silent. And by the time you get cirrhosis, you won't even know about it. So we're targeting that disease state. Another important disease in our valley is hepatitis C. So as part of our hepatitis C treatment and our fatty liver treatment, we acquired a FibroScan. It's the one in the area for many, many miles. And so we're very proud to have acquired it. And that is a non-invasive way of testing how scarred your liver is. The biopsy is actually a tissue examination of the liver, and it is more accurate than the FibroScan, but it involves having a needle piercing into your body and taking a sample out, which can be traumatic and sometimes have complications. The FibroScan sends a sound wave through your body, and so there's no piercing or anything involved in that, so a lot safer. The patients need to follow the instructions for colonoscopy prep, get themselves cleaned out real good. It makes a big difference. The cleaner they are, the better we look. And the better we look, the more we see, and so that's what we want. And if they get a negative checkup with a good look, then we can check them every 10 years. But if not, then the patient will have to pay a little bit and get checked sooner. So I really want to emphasize that they really have to follow our prep instructions to get the best checkup. And so the practice works like a big wheel. Everyone's a little cog in that, turning that big wheel. It's an undescribable feeling. You get to help so many people in one day. You really can't find this anywhere, really. I don't think it's a big city thing or a small city thing. You just can't find what they have here.